In 1955, President Dwight D. Eisenhower suffered a massive heart attack. To prevent further blood clots from reaching his heart, his doctors prescribed a new, high-stakes anticoagulant medication. While the president was using this drug to recover, the exact same chemical was being sold in hardware stores across the country as a lethal rat poison. The origins of this medicine trace back to the 1920s, when farmers in the northern U.S. and Canada encountered a baffling disease. Their cattle were suddenly dying from internal bleeding and minor injuries that should have been harmless. This wasn't a discovery made in a clinical setting. It began as an agricultural crisis, where routine procedures like dehorning or branding were causing healthy livestock to bleed to death without explanation. Farmers eventually identified a pattern. The cattle only became ill after eating spoiled sweet clover hay during the winter. Cows eating fresh clover remained healthy. This suggested that mold growing on the damp hay during storage was reacting with the plant to produce a powerful, hidden anticoagulant. In 1933, a farmer arrived at the University of Wisconsin-Madison with a bucket of blood that refused to clot. He presented it to biochemist Carl Paul Link, pleading for an answer to why his herd was dying. That bucket of blood moved the investigation from the farm to the laboratory, initiating a years-long search for the specific molecule responsible for the hemorrhage. Link and his team spent 6 years attempting to isolate the toxic agent. It was a difficult process because the compound existed in only trace amounts within the moldy hay. In 1940, they finally identified the molecule, dicoumarol. The process begins with a substance called coumarin, which is naturally found in fresh hay and is harmless. But when the hay spoils, fungal metabolism alters that coumarin, transforming it into the toxic dicoumarol. Once consumed, dicoumarol interferes with the liver's ability to recycle vitamin K. It essentially creates a blockage in a cycle the body relies on for survival. Without recycled vitamin K, the body cannot activate clotting factors 2, 7, 9, and 10. When these factors are missing, the blood loses its ability to form a solid plug. By mapping this specific pathway, researchers discovered how to intentionally pause the mammalian clotting system for the first time. Link's lab began synthesizing variations of the molecule to find a more powerful version. Their 42nd compound proved significantly more potent than the original. They named it Warfarin, an acronym for the Wisconsin Alumni Research Foundation, WARF, paired with the suffix from coumarin. Because the compound was so effective at preventing clotting, the medical community initially viewed it as too dangerous for people. In 1948, it was released exclusively as a rodenticide. It was highly effective due to its delayed effect. Rats consumed the bait repeatedly, unaware of the danger until developing fatal internal bleeding days later. The drug's reputation as a lethal poison was so established that its potential as a medicine was largely ignored by its own creators. In 1951, a U.S. Navy recruit attempted suicide by consuming a large quantity of warfarin rat poison. He survived. Doctors were able to stabilize him by administering high doses of vitamin K1, which successfully restarted his blood's clotting process. This recovery demonstrated that the drug's effects were not permanent. If the dosage was carefully managed, or if a sudden emergency occurred, the anticoagulation could be reliably stopped. This realization led to warfarin's approval for human use in 1954. It worked by inhibiting the enzyme VKORC1, allowing doctors to thin a patient's blood to prevent strokes and heart attacks. The recruit's survival provided the evidence needed to reconsider the poison. It showed that with vitamin K as a control, the compound could be transitioned into a viable clinical tool. Using warfarin today requires staying within a narrow therapeutic window. Too little of the drug fails to prevent clots, while slightly too much puts the patient at risk of a major hemorrhage. Common foods can disrupt this balance. Leafy green vegetables are rich in vitamin K, the very nutrient the drug is trying to block. Eating a large amount can tip the balance back toward the risk of clotting. Genetic variations also play a role. Differences in the VKORC1 and CYP2C9 genes change how individuals metabolize the drug, meaning there is no standard universal dose. To manage these variables, patients undergo regular blood testing to measure their international normalized ratio, or INR. This allows doctors to adjust the dosage and keep the blood's clotting ability within a safe range. Despite the availability of newer drugs, warfarin remains the primary choice for patients with mechanical heart valves. Decades after the investigation on the Wisconsin farm began, a compound once used to clear barns remains a staple of modern cardiovascular care.